Welcome, viewers. This evening, this is Health Up show, and we are glad that you're joining us as we just discuss and engage. And I want to believe that this is a very beneficial show to all of us. I want to take this chance to just request us if you can invite a friend, if you can just share this on your Facebook page. You can just go on the Facebook page, Elevate TV. I want to believe you have liked and followed this TV program and TV station. You can share, and so that most of us and most of our friends can be able to see what is happening, and we can be beneficial. Don't eat something good alone. I mean, share with your friends, and this will be great for all of us. If you're in the office or maybe just about to leave the office, catch us on our social media platforms, on YouTube and our Facebook Live. And if you are just at home or just arrived or so, or you've been in the house, Elevate TV is the place to be. We are on Pang Elevate, and we trust God that this is going to be a blessing to all of us, even this evening, as we discuss more health matters. Remember, we endeavor to bring knowledge. We endeavor to bring in new skills, where that's appropriate, and we can be able to demonstrate, and that becomes appropriate, and you can be able to learn, and also change our attitudes, because we are who we are because of the attitudes that we hold towards certain aspects, or towards certain issues, or towards certain dimensions. And therefore, this is the place whereby we look forward that we can be able to have the best, or change our attitude to be better than the way it was the day after, the day before, or the day, and the day becomes better in the days to come. So karibu sana, welcome so much. This evening, I'm glad to, have been joined by a longtime friend of mine, and a colleague, at some point who, we met and practiced together. And time and again, we have been able to communicate, and here he is, Isaac Wahome. He's an audiologist. An audiologist is, a specialty or a subspecialty that is in the ENT. And probably just to give a brief on who Isaac is and who our guest is tonight. Isaac is one who has been trained in clinical medicine and surgery, and also has, a postgraduate training on the same in matters ENT, what we call the ear, nose, and throat in Nairobi, and also, hearing instrument science in Zambia, hearing aid audiology, Edinburgh, London, and master in clinical audiology and hearing in Spain. And we are glad, sir, that, with this knowledge, accumulated knowledge from different parts, and different regions of the world, you have, and also, of course, because of your years of practice, you are able to bring us all this knowledge and all this wealth of experience. We are glad and we are humbled. Thank you very much. Tonight, you're going to be looking at, or this evening rather, going to be looking at, hearing loss, but we look at treatment and rehabilitation of hearing loss, because, we realize most, and we have a very big population we have a very big number of people, or a big population, a proportion of individuals who suffer from hearing loss as a cause of disability. But the question is, what next? Don't just sit back in the house. That's why we change the attitudes. Don't just give up. Don't just be frustrated. This is the forum. Kindly follow us, in the next 1 hour or so, and we're going to bring out these matters, and this could be your day that we change your life, and your life is changed forever. So kindly tune in. There are numbers that, are going to be going down on your screen. Leave us a comment, leave us a question. Peradventure, you can use the same platform to help all of us. Right. Thank you very much. So, Isaac, probably you can say hi to our viewers, and, say something about yourself as you've come into this show, from Dexter Hearing and, Specialist Center. We are happy. Karibu sana.
Thank you very much
Right.
for according me this great opportunity to meet our beautiful viewers across the globe, wherever they are watching us, either on Facebook,
Yes,
on YouTube, and on the TV. Thank you very much. Like you said, Isaac Wahome, and I practice as the private practice in Dexter Hearing Center. And I'm glad to join you up and share to the community about public health concern.
true.
And one of the major public health concern is on hearing loss,
Right.
and how we can be able to help patients who have hearing loss.
Right.
It's a burden that needs to be addressed.
True.
And I know some people don't know how to get help or where to get help. It's like an amazement. It's
Right.
a park,
Right.
everything is intertwined. You really don't know where to go. Yeah, so I think it's a great opportunity for that Elevate TV is providing for our viewers,
Right.
so that at least when they have issues, they can call us, they can look for us, and we can help out.
Wow.
Yeah.
Awesome. When you say audiology, what is audiology?
So audiology is a branch of medicine that basically deals with hearing and balance issues.
Okay.
It's quite broad, but I think I can categorize into that. And then we work with teams.
Okay.
We don't work independently.
Right.
We work with the ENT surgeons.
Yes.
We work with the speech therapists. We work with the
Yes.
social worker.
Yes.
We work with the psychiatrist. We
Yes.
work with the pediatrician. It's basically a team that works to help and rehabilitate either adults or children who have hearing and balance problems.
True.
Yes.
True.
Yes.
Now, when we talk about hearing, hearing loss and treatment or rehabilitation of the same, maybe some of the things our viewers would want to understand. Of course, moving from what we can understand, from what we know.
Yes.
What would you say is good hearing?
Okay.
If there's such a terminology, for lack of a better word,
Okay.
good hearing. When would you say we have a loss, so that we now can be able to identify who is this that is getting hearing loss, who is just affected, and how we can be able to help them?
Okay.
Yes.
So hearing is basically a fascinating thing.
Right.
It's complex, but it's a very simple way.
Right.
That sometimes we don't think about it.
Yes.
When we are with hearing. So, and usually what happens, the mechanism of hearing is sound travels from the outer part of your ear across to the brain.
True.
And any interference within that system can cause what we call hearing loss.
True.
So, and hearing loss can either be reduced or it can totally lose your hearing. And there are many causes of hearing loss, ranging from just the common things like wax in the ear,
True.
To damage or head injury that can cause hearing loss.
Right.
So, ranging from all that,
Yes.
there are very many ways that we can do intervention.
True.
And intervention is basically based on number one, prevention.
Prevention.
As we always say, prevention is better than cure.
Absolutely.
Of course, there are very many statistics that say up to 60% of hearing loss is preventable. And one of the main preventable mechanism is basically a simple thing like screening. Making sure that you have regular checkup.
True.
If you're working in an occupation,
Yes.
of course, if you look at OSHA requirements of 2007, they say that before you enter an employment and on exit of an employment area, you have to be done a hearing test. Of course, we are talking about education of people.
So before, as we move into that, when we talk about OSHA, we're saying there are policies in place.
Yes.
There are stipulated guidelines in place.
Absolutely.
For workers,
Yes.
in places, in organizations,
Yes.
in places of work,
Yes.
whereby they're not supposed to, they're supposed to be tested first,
Yes.
so that their work does not jeopardize,
Yes.
their hearing and
Yes.
ultimately cause them a disability. Well, I think this is important for our viewers to know, because sometimes we don't have this information.
Yes.
We don't have this. We don't have this knowledge that these things are available.
Yes.
And sometimes, some of us or some of the people within the community are exposed to industries, and after some time, 5-10 years, there's a problem.
Yes.
And the question is, did the problem arise before or in the course?
Yes.
Knowledge is power.
Perfect. So that's what we are saying, for especially noise-induced hearing loss is a very common industrial cause of hearing loss. And in this country, there are laws that are governing such practices in terms of regulating workers that are exposed to sound, that they have to perform annual hearing test. If you're exposed to certain decibels or exceeding certain decibels,
Also,
of course you are given a certain allowance in terms of time. Of course, there's the provision of protective equipments like earmuffs or earplugs in such areas, including even the church.
Yes.
There are very many celebrities that are known that have lost their hearing as drummists, especially drummists.
Okay.
So, just a simple earplug can help you a lot. An earplug. So, these are some of the things that we we have to educate our people that prevention is better than cure.
Exactly.
And noise is a huge burden. Noise is a huge burden. And of course, when you talk about other things, we shall talk about them in details that can cause. So we have those laws that are in place in terms of even regulating how much sound is emitted. Our devices that we have, like mobile phones,
Yes.
there's world declarations in terms of regulating sound, such that if you put your earphone and you increase the volume, it
Yes.
has to warn you
Yes, it
when
has
you're
warning, yes.
exceeding
Yes.
a certain decibels.
Yes.
So those are some of the basic measures that we can use to regulate or to protect ourselves against sound or noise.
Do you what word would you have, as you look at this in terms of some of those measures, some of the preventive measures, in terms of, because you're talking of policy,
Yes.
are there probably even policies that address buildings, that address structures,
Yes.
structural buildings,
Yes.
so that you can be able to noise?
Yes.
You enter some of the places, there are echoes.
Yes, yes.
Others are just so small and all that. Do we
Yeah.
have some of those in place? Do you have guidelines and laws and policies in place to regulate this?
Definitely. I mean, like institutions like NEMA, if you go into their laws, they talk about how much noise should be emitted in a certain area, and
Yes.
it should be, then either the workers within that areas, you should have personal protective equipment, and the commonest being earmuffs and things like that. Those,
Yes.
again, when you're talking about echoes,
Yes.
even in churches, even
Yes.
in classroom,
Yes.
at least the engineers, sometimes they consult the audiologists or the acousticians,
Yes.
in terms of making sound not to reflect back or have echoes.
Yes.
Even in classrooms, especially for our children.
True.
When they are sitting in classroom, probably a child who is sitting in a classroom and is sitting next to a door. Every time the door opens, sound
Exactly.
is lost. So, or when they're sitting next to a window, there's usually bouncing of sound across the window. So sometimes they lose some aspect of communication and
True.
speech.
True.
So I think those acoustical requirements are very important.
Right.
That is why you'll see probably in a church or in a place or in studios, there are carpets,
Yes.
so that they can dampen sound. Of course, the sounds or the walls are, they're double walled, so that they can basically dampen sound and reduce a lot of reflection and deflection and echoing of sound, what in audiology we call reverberation of sounds.
Wow.
Yeah.
Wow. This is interesting. Viewers, tonight, ladies and gentlemen, we are glad that you joined us. We're discussing and looking in matters treatment, rehabilitation, hearing loss. How can we be able to bring back, what has been lost or what is, not functioning appropriately? But adventure will improve the quality of life. And you have our guest, Isaac Wahome, who is an audiologist, and we are glad, sir, that you joined us. I'm just thinking about, we're talking about 60% of sound, 60% of hearing loss being preventable with the causes you're talking about, and you've really, hammered, noise-induced hearing loss.
Yeah.
I'm thinking about where we live, where we stay. Some of the apartments are very near to busy highways, busy roads, and every morning, and every time during the day and evening, there are all these, there's all this traffic and all this noise. And, you have all these huge apartments full of people. And I'm basically thinking, these are things that we need to think about.
Yeah.
These are things that we need to take deliberately. And I know they are multidisciplinary. They will go into issues with the council government and all that, and approvals. But as you say, let's be deliberate.
Yeah.
Let's be deliberate. Let's know that these things, are actually possible for them to happen.
And when you're talking about there are some admissible or allowable noise.
Okay.
And the current practice is we are talking about safe listening.
Yes.
So, for example, there's sound in everything.
Yes.
During probably when you're in a library, you realize that the sound level is probably around 40, 45. When you're having conversation or people are talking is around 65 decibels. When you start now having motorcycles and all those kind of things, the level are going up. So like now in a traffic, you probably reach at around 70 decibels and so on. So now the admissible or allowable sound in many in relations to regulation. So there are certain levels that if you're exposed for long duration of time, then can easily cause hearing loss. And we have social issues, social types of noise-induced hearing loss, like listening to music, like going to places where there's loud sound, or occupational. If you're working in industries or with an equipment that is noisy, it could be even at home when you're using a grinder, when you are mowing, when you're doing something like that. I think one of the most important things when you're talking about safe listening is to be aware of the environment. And once we know that the levels are high, then we have to take measures.
We have to take measures.
And there are simple measures like putting earplugs, and they're not expensive. Those things, they are very cheap. Yeah.
Absolutely.
When you're going for a matatu, young people like those booming matatus.
Yes. And they actually charge it even higher, and people, sorry to say, young people are busy flocking there.
Yeah, so they like them.
Yeah.
So, and usually these young people, when they come out of the matatu, some of them, they either, one bang.
Yes.
One bang or loud, sudden noise can cause sudden hearing loss. There, and it is permanent.
Wow.
Or sometimes being in that, constant loud sound, when you come out, you get
exposure.
What we call temporarily hearing loss. So your hearing loss sort of goes down, and then it starts building back after 30 minutes or so, and you're like, oh, okay, now I can be able to hear. So you realize what we call the party effect. If you go in a noisy place, you'll tend to increase your voice as you speak. And then when you come out, you still speak loudly. And somebody who was not there is like,
what is happening?
What's going on? Why are you speaking loudly? That is what we call the party effect.
Party effect.
As a result of increased acoustic stimulation on the organ of Corti.
Yeah. Wow. Yeah. Viewers, what you're just saying is it is not expensive, to take care of our hearing, but it's really expensive for us to restore it. It's going to demand a lot of effort. So the best way and the easier way out is, let's see how this can actually be restored. Kindly interact with us, through our social media platforms, and the number that's going down on your screen. We'll be happy and glad to hear what is happening on your head. What is your experience, or share some of the things that you want to, also get back to us. If there's a question and we can be able to get back to you, we'll be glad to hear that. So thank you very much and keep watching. Now, Daktari, who is affected? I know we have been, taking this to and fro, in the course of this, but basically, who is, when we talk about hearing loss, because we need to talk about how we restore it, how we treat it, and all that. So who are we treating? I mean, who is affected by hearing loss?
Okay. So basically, hearing loss can affect anybody.
Yes.
It can affect anybody at any age, from birth up to the elderly.
Yes.
It can occur at any time, any point. And when you talk about treatment, it is indiscriminate.
Yes.
That you can treat anybody who has hearing loss, whether young or adult.
Yes.
Now, when you look at the extremes of age, that is the young people and also the elderly people.
Because they're very old, very young, very old.
Yes. The extreme of age.
Yes, the extreme of ages.
Tends to be affected more.
Yes.
One, the young ones, is that they don't voice their concern. You just react. And it is very sad because even in our clinics, in our clinical setup, we tend to see these children when it is too late.
My goodness.
By 5 years of age or 3 years of age, or even 6 years of age, when they're supposed to go to school, is when the mothers come and the first thing they report is that the children are not able to speak. Remember, the brain of a child is like a sponge. It takes in whatever signal comes in. So the more you talk to a child, it's like a bucket. You put in more sounds. That's when they'll be able to speak back. So these children, when they come to the clinic, one of the symptoms or one of the complaints that the parents bring these children is their child are not able to speak.
Are you
They
saying-
don't have speech.
Are you saying
Yes.
if they are not hearing,
Yes.
they are not able to speak? The child will speak
Yes,
because the child is able to hear.
this definitely.
Wow.
Very high chance that a child who is not able to speak, there is a problem with hearing.
Wow.
And they will always come to clinic when it is too late.
Yes.
Now, when we talk about hearing screening and hearing management,
Yes.
like you said, we start as early as 1 month of age.
Yes, actually, yeah, you can actually delve into that.
Yeah.
Is begin. Treatment and all that is
and we
management of
fit
hearing loss.
hearing aids as
Yes.
early as 6 months of age. So this extreme of age, like I was saying, they will be picked from school either by the teachers, they'll be brought to clinics by the mothers when they're complaining either they can't be able to speak, or they will come complaining of inattentiveness or hyperactivity or frustrations or those kind of psychiatric,
Yes.
issues.
Manifestations. Yes.
Manifestations as a result of hearing loss. And then with the elderly, it is totally opposite.
Oh dear.
What happens is that the aged people, once they are hit with the hearing loss, they withdraw. Although it happens with every other age group, but most of the time they withdraw. They don't want to talk a lot. They feel lonely and isolated.
True.
And it's like a vacuum
True.
of fear
Yeah.
and isolation.
Yes.
And so on.
True.
Although this might actually, some of the symptoms might actually happen to anybody. In terms when you're talking about isolation, withdrawal, fear, and all those kind of things, they can occur to anybody. But mainly they present with, you have to speak louder to them so that you can hear them. You have to
Right.
talk repetitively.
Yes.
They have to look at you and lip read.
Wow.
So that they can understand what you're saying.
Yes.
And now with the COVID era, we are having a lot of issues where in school, children are not able to follow teachers because teachers have masks.
Oh my goodness.
Okay. So these children, because they can't be able to have attention, they can't be able to follow the teacher if they used to have lip reading. So they tend to do some funny things, and
Absolutely.
probably they are disciplined.
Yes.
They are chased from class. Parents are called from school. I think there's a problem with your child. And this is as a result of hearing loss. Again, for adults, when you are not able to lip read, the other person, so you tend either to come closer, and
Yes.
with COVID, you don't
With
want
COVID,
to come
there's an
somebody-
issue. Social
you don't want-
distancing is another matter.
You need social distance.
Yes.
So you tend to run away from these people. Again, they have to speak louder and so on. So I think now, as we really are encouraging people to wear masks. At the same time, if you have an hearing issue, it has to be sorted out. And when you come to audiology, again, we tell you how to live or how to have effective communication
Yes.
with the mask and probably with a hearing aid, or
Yes.
your problem with hearing
Yes.
loss, how to do that. Yes.
My goodness, COVID and hearing.
Yes.
Quite an issue.
It is
I mean, COVID and hearing loss, because now someone has to be empowered to hear, because lip reading becomes a problem.
Yeah.
And you have these people, especially children at school.
Yes.
Now, before we go for a break, just probably you can look at it broadly. I know we will have some time to, break this down into smaller pieces. But what are some of the treatment for hearing loss, would you say? Yeah, or management.
So when you talk about number one, you have to know what caused hearing loss.
Understand what caused the
Yeah.
hearing loss.
Sometimes you might be done a lot of investigations just to find out what caused. Sometimes some blood work, especially when you're talking about infections and so on.
All right. Yes.
Yeah. So apart from blood works, there are many other things that can be done to diagnose hearing loss, and then so that you can be able to treat
Yes.
the hearing loss. So you have to, for example, when you visit an ENT practitioner,
Yes.
they'll probably look into your ears,
Yes.
and if there's wax inside there, they'll probably need it removed so that they can actually further see inside the eardrum, see whether the eardrum is intact, whether it is perforated.
It's true.
For children, very, 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 very common is when they have fluid build up behind the eardrum, what we
Okay.
call otitis media with
Otitis
effusion.
media, yes.
And so when we talk about categorization of treatment,
Yes.
we have the medical treatment,
Yes.
we have the surgical treatment, and we have the habilitation and rehabilitation by the audiologist.
Okay.
So the medical treatment involves either getting medications,
treatment for that.
especially for infections,
Yes.
or some ear drops,
Yes.
or some injections. And then the surgical options involves now repair.
And Dr. Before you even go to the surgical option,
Yeah.
Medications rather are a cause of hearing loss.
Perfect.
And some of the things, that we experience outside there is, someone would even go over the counter medicine and they say, I feel like my ear has a problem. Please tell me some ear drops that I can put in my ear.
Perfect.
And those ear drops could actually accelerate or make the problem worse. Because what if it is in the class of the medications that you as ENT specialists don't advocate because they actually damage the ear?
Yes.
So what we are saying, even to our viewers, is self-medication again. We keep on voicing this time and again every time we find opportunities. Let these problems be diagnosed. Don't just say, my neighbor had an ear problem, was having hearing loss, was given some eardrops, and you just go to the next chemist and the next pharmacy. No, we are saying let this be diagnosed.
Yeah.
So the medications have to be from a prescriber.
Yeah. So I mean, that's a huge chunk of our problems that we are having, where people are doing self-medications and they end up causing some problems. Now, like you said, there are a lot of myths and facts and practices that we do traditionally.
Yes.
One of them is the use of probably some fluids. I've seen so many, putting oils, some either, oil. They have different ways, local things that they put inside the ear. Some people will tend to clean up the ears with earbuds. What we really discourage. We really discourage the use of earbuds. We say if it's another party doing it for you, that's better. But if it is yourself doing it, you can basically injure yourself. You can imagine when you're putting a cotton bud here and you're giving stories and they're very interesting. Somebody comes in from the back and bumps you. Of course, it will go through to the eardrum. We have seen people when they are removing their earbuds,
comes out.
I mean, like the piece remains inside, and it's only the stick that comes out, and of course it blocks your ear. If it is wax, probably that had come all the way, and then you push it back. And
it's quite. We are saying that this is going. We are causing more problems than they actually were.
Yeah.
Hold that, Daktari, because we need to go for a break.
Yes.
We need to answer that question: earbuds or no earbuds. What do we need to put in our ears and what we don't need to do with our ears? We need to protect them. We're going for a short break. Keep it elevated. Don't touch that dial. Keep watching kindly. Thank you.